let's dig a little deep and get into some ventricular blocks. So we have in our ventricles, we've got two bundle branches. We've got a right bundle branch, we've got a left bundle branch coming off of the AV node, the bundle of His. Right bundle branch goes around the right ventricle, obviously. Left bundle branch does the same around the left ventricle, but the left ventricle is a lot bigger, just size wise, muscle wise than the right ventricle. So our left bundle branch branches again into the left anterior fascicle and the left posterior fascicle. So we've got our SA node, we've got our AV node, a bundle of His, and then that branches off into the right bundle branch and the left bundle branch, and then the left posterior fascicle, which wraps around the backside of the left ventricle, and the left anterior fascicle, which wraps around the anterior side of the left ventricle. Right bundle branch ends in these Purkinje fibers. Left bundle branch branches again into the posterior anterior fascicles, and those two fascicles then end in the Purkinje fibers. What normally happens is these electrical impulses go through the SA node, the AV node, bundle of His. They're normally conducted down this highway, down our bundle branches, right and left, and then they innervate the myocardium, totally organized fashion, and they depolarize, and our heart muscle contracts in a very organized way. When we have a blockage of our bundle branches, one or the other, and I don't mean like a clot blockage, but an electrical blockage of a bundle branch, well, that impulse can't go down that normal highway, has to take a side road. And those side roads are terrible. They're not paved. It's just gravel, right? So you're heading down Interstate 40. It's nice and great, but all of a sudden Interstate 40 is closed, and you have to take this like side road, this dirt side road. You have to go a lot slower. It's a little bit more dangerous. It's not so comfortable, right? So instead of going down this normal conduction pathway, now this electrical impulse has to go directly cell to cell to cell to cell to cell to cell, and that is super slow. It's a little bit chaotic, and because of that slow, chaotic pathway, what we see on the monitor, what we see on the EKG, is this wide complex because it's slow. And slowness on our EKG is wideness. It's lengthiness. So we see this wide, kind of bizarre QRS complex. It looks big, looks weird, looks funky and bad. So how do I identify a bundle branch block by looking at my EKG? Well, first, it has to be a wide QRS complex. Has to be a wide QRS complex. You see a wide QRS complex? Start thinking bundle branch block. And from there, we're going to look at V1. We're going to do this turn signal method. I'll talk about that here in a second. I'll look at V1, do my turn signal method, and that's going to point me in a direction of a right bundle branch block or a left bundle branch block. And then after that, my third step is confirmation. So I'm like, oh, okay, I've got a wide QRS complex, number one. Number two, my turn signal method is pointing me in one direction or the other. And then number three, I'm going to confirm that number one and number two are true. So confirmation, I'm going to look at lead 1 and look at V6. So first off, I'm looking for a wide QRS complex. So what is a wide QRS complex? Well, it is 0.12 seconds or greater or wider. So that's going to be our wide QRS complex. So 0.12 seconds is our cutoff point. So 0.12 seconds or wider or greater is going to be a wide QRS complex. Second step is this turn signal method. And my turn signal method, I'm looking at V1. Always go towards V1. So I have a wide QRS complex. I go, okay, I have a wide QRS complex. That might be a bundle branch block. Next step, this step 2, I'm going to go to V1, and I'm going to look at the J point and work my way backwards. So what's the J point? Well, the J point is where the QRS complex ends and the ST segment begins. So I'm at the end of my QRS complex, and I'm going to work backwards in time. So I'm at the end of my QRS complex, and I'm going to look to the left. I'm going to look backwards. And if the amplitude backwards goes up, I might have a right bundle branch block. That's what I'm thinking. If I go to my J point and look backwards and the amplitude goes negative, it goes down, I might have a left bundle branch block. So that's what I'm thinking. And in step 3, we're gonna confirm this, but I'm going to my J point where my QRS ends and my ST segment begins. I'm looking backwards. If it goes up, maybe a right bundle branch block. If it goes down, maybe left bundle branch block. Just like your turn signal on your car. If you hit it up, you're turning to the right. If you hit it down, you're turning to the left. So amplitude goes up, I hit my turn signal stock up, I'm going to the right. The amplitude goes down, I'm hitting my turn signal stock down, I'm going to the left. So that's the turn signal method. Now step 3, we have to confirm. So I've got a wide QRS complex, number 1. Number 2, I've done my turn signal method, and maybe I have a left bundle branch block, maybe I have a right bundle branch block. Now we have to confirm, because these things can happen and not be a bundle branch block. So we have to confirm. So in a left bundle branch block, I have a wide QRS complex, step 1. Step 2, my J point going backwards, I have a negatively deflected complex in V1. So turn signal down, I'm going to the left. To confirm, I look at lead 1 and V6, and I will have monomorphic upright QRS complexes. So I'll have these like little upright mountain complexes in lead 1 and V6. With my right bundle branch block, I've got a wide QRS complex, step 1. Turn signal method, J point going backwards into the QRS complex. I've got an upward deflection. If I hit my turn signal stock up, I'm going to the right. Maybe I've got a right bundle branch block. Confirmation, again, lead 1 and V6. So we're looking at lead 1 and V6 for confirmation in both. And in the right bundle branch block, lead 1 and V6, I'm going to have slurred S waves. It's a little subjective, but my S wave is going to take a little kind of extra time to get back up to baseline. So I'm going to have these little slurred S waves. Let's do a couple examples real quick. So I've got this 12 lead EKG. Looks kind of funky. Looks kind of dirty. Looks a little weird, right? So step 1, I definitely have a wide QRS complex. Definitely greater than 0.12 seconds. So what I'm going to do, I'm going to go to V1 first, and let's do our turn signal method. I'm going to go to the J point. So J point is right about here, where the QRS ends, the ST segment begins, and I'm going to go backwards. I'm going to go backwards in time. Right. I can go backwards in time. And does the deflection go up or does it go down? I just lost my mouse. There it is. Does it go up? Does it go down? If I go backwards, it goes up. If I hit my turn signal stock up, I'm going to the right. I turn my right turn signal on. So I'm thinking right bundle branch block. Maybe, kind of, sort of, maybe, right? So that's my first indication. Well, now we have to confirm. So I'm going to look at lead 1, and I'm going to look at V6. And to confirm a right bundle branch block, I'm looking for slurred S waves. And in lead 1, I definitely have a slurred S wave. So I'm going to go to the right. I'm going to look at lead 1 and V6. And to confirm a right bundle branch block, I'm looking for slurred S waves. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a slurred S wave. And in lead 1, I definitely have a sl slurred S wave. Just takes like a little bit more time to get kind of like back up to baseline. Slurred S wave there. In V6, I definitely have a slurred S wave. Takes a little bit more time to get back up to baseline. Right? So that's what we're looking for in slurred S waves. Just takes a little bit more time to get to your baseline. So slurred S wave in 1, slurred S wave in V6. I've got this turn signal method upright complex in V1, and we have a right bundle branch block. On this EKG, again, there's a lot of pathology here. There's a whole bunch of stuff that looks weird and funky and kind of pops out at you. But QRS complex, step 1, definitely wide, greater than 0.12 seconds. So this is a wide QRS complex, so we're looking for a bundle branch block. Look at V1. Where is the J point on V1? So J point's like right up here. Right there. So if we go backwards in time, right? If we go backwards, does it go up or does it go down? It goes down. So J point going backwards, negatively deflected. I hit my turn signal stock down. I am taking a left-hand turn. So thinking left bundle branch block, but I need to confirm it. So I'll look at lead 1 and I'll look at V6. And in lead 1 and V6, what I'm looking for is monomorphic upright mountain complexes. Definitely have that in lead 1 and definitely have that in V6. And you might be thinking, well, what about this guy? Right? Remember that this 12 lead is a 10-second strip, and up and down are temporal. All of these are happening at the same time. So we can look up and down, and all these complexes are happening at the same time. You can look up and down. These are just aberrant. This is an aberrant beat. I can't see anything before that. Might be, that might be a PAC. Might be something funky. Might be a PJC. But it's something funky. These are the actual complexes right here. So I've got little mountains here. I've got little mountains here. I've got monomorphic upright complexes. My turn signal says left bundle branch block. I can confirm it, and this is a left bundle branch block.